Good afternoon again from the Endovascular TV. Now I have the honor and the pleasure to interview Dr. Greenhalgh, which is a very well-known vascular surgeon. Dr. Greenhalgh, which is the future of the endovascular therapy? Where are we going, or where should we go?
Well, you have to put it into the context of the development of the management of vascular disease. And there was a time when it wasn't possible to do any surgical intervention for vascular disease in my lifetime. In the 1950s, 60s, 70s, open surgery was the method. And around 1990, at that time, the endovascular possibilities were with us. And then has been an era of a comparison of the standard open surgical methods against the new endovascular. And we're now at a time where more than between a half and three-quarters of patients are managed by endovascular means in different parts of Europe. And in the United States, even 75% of a population would have, for example, their main artery of the body, the aorta, completely replaced by endovascular methods. And so that's where the endovascular is in history. It is now at the height of its powers and the height of its prominence.
And following your interesting works on EVER trials, will we continue operating aneurysms with endovascular procedures, or we should still keep going on open surgery?
People will make their own mind up. The importance of trials is to evaluate new treatments compared with existing treatments, because the doctor has a patient in front of the doctor, and the patient wants to know which choice to make. And so the doctor needs to know exactly which method to recommend to the patient, and as if the patient was a member of that doctor's family, and they would want the right treatment. And so a trial is about the facts of which works better in which situation, which is not to say that open surgery will finish completely, because you never know when you're going to need the skills of open surgery to restore a situation. And endovascular can sometimes fail and require the skills of open surgery.
Yeah, but after first EVER trials, for example, when endovascular surgery didn't prove to be better than open surgery, more and more groups used endovascular surgery. So are trials useful, or?
I should be talking about that in the main hall very shortly. It's strange you should mention that. But the moment the 5-year results of the EVER trials came out in about 2005, there was a massive upsurge in the sales of endovascular devices. Now, I had no shares in the company, so I didn't personally benefit from this, but the companies are to be congratulated for having made such brilliant devices, getting better and better all the time. And when the trials started to report at least that the endovascular was as good in many ways as the open, this was an endorsement for the endovascular method. But we haven't finished yet, because there are some problems about endovascular which need to be followed more carefully.
Changing the topic, we are asking about symposiums, about congresses, meetings. Which kind of meeting should we do in the future? More little or small meetings, or more huge congresses, more pro-contra sessions, more live cases? Which is the meeting of the future?
Well, the reality is that there's a limited budget for doing meetings the world over. And I see that there will be some coalescence of meetings. There will be some that are funded out of a global budget for a global need, which will have people from New Zealand and America and Asia, Latin America and the Far East, and everybody's there. And that may only happen a couple of times a year in different parts of the world with airports that serve it. But there will always be a need for a meeting like SITE, because that serves the Spanish language and the Spanish people, and would, for example, be very attractive for a lot of South America. So
Sure.
A meeting in the Spanish language is absolutely very welcome and required. And it's no good expecting all the education to be in the English language. It's all very well saying that there's a universal language, but it's more comfortable in your own language, and patients will benefit if the doctors really understand the right way to treat people. So I think the national meetings, particularly where there's a language issue, are very crucial.
Thank you very much. And about these initiatives like the endovascular TV or some kinds of congresses, online congresses, do they have any kind of future, or they should be more presential meetings?
No. I even ask myself whether congresses will survive and whether they won't be there at all in the future. Will it all become electronic? And people have asked the questions about newspapers. Will newspapers survive now that you've got Twitter, now that you've got all of the new social media, blogs? And the answer is that the social media, in that case, brings immediate news. And the newspapers are the next day or two put the news into context. And people comment upon the news, and it's commentary upon the news. No longer is it the latest news, but a commentary on what opinion leaders think. And we read that. So from the newspapers, who at one point we thought might be threatened, in fact they're not. Nor do I think congresses will be threatened completely, but they will have to be thought through in a rational way. And the reason they won't disappear is because the management of vascular disease is managed by a family of people. It's managed by the family of the clinicians, physicians, surgeons, interventional radiologists, interventional cardiologists, and the companies that make the devices that enable us to make our patients better. You can't get that family feeling and communication online. You just can't get it, which is not to say that the online won't grow. And in a meeting of mine in London recently, we had a live online broadcast, and it reached 700 people in Africa, India, the Far East, Middle East, Russia, South America, and the United States and Canada. So I have no doubt that that will be a good education medium, and I think it will grow. I think education, anything that brings education closer to the people is a benefit, but I don't think Congress has disappeared.
So the future is not only in the vascular, but also the social meetings.
It's not a social meeting. You're not there to drink champagne. Correctly, European and American law and national law is not going to tolerate that. So that was a naughty question, and I think you have got a vested interest in not having meetings so that you can do everything online, and you won't win. Because, you see, when people meet, something else happens. You can have a number of disciplines and clinicians and companies and inventors, and the very presence will bring about advance. So they won't disappear, although the electronic media will grow with my support.
It was a pleasure to have you here. Thank you very much.
Thank you.
Thank you.